Namaskar, welcome to all. Once again, we are here with you to introduce CYP introduction program. So, let us start the CYP introduction program 9th day with practical session. So, for practical session, start with prayer. Sit comfortably in any meditative posture, Sukhasana, Ardha Padmasana, Padmasana or Vajrasana. And now, adopt Gyan Mudra of both hands and place your hands on your knees. Make your back straight, check your spine. Now, slowly, gently close your eyes. Keep smiling, a beautiful smile on your face. Now, observe your body. Feel the touch of your body with the ground. And now, feel the flow of breath, inhalation and exhalation. You are not inhaling, you are not exhaling. It's involuntary movement, and observe it. Let's start the session with prayer. Inhale deeply for Omkar chanting and mantra. Join your palms together and inhale deeply. Sehna bhavatu Sehna bhunatu Seheviryam karvavahi Tejasvina vadhitamastu ma vidvishavahi. Om Shanti Shanti Shanti. Feel the impact of prayer and gently place your palms on your eyes and open your eyes. Now, we will move towards the loosening practices. So, please stand at your place for loosening practices. These practices help to increase blood circulation in the body. We begin with the neck practices. So, for neck practices, first we align our body, stand straight with feet 2 inches apart, keep the hands by the side of the body and surrender your body weight towards the floor. Align your body. This is Samsthiti. Now, we start with forward and backward neck bending. Place your hands on your waist. Exhale, bend your head forward. Try to touch the chin to the chest. With inhalation, raise your neck up, take your head back and feel the stretch on the front side of the neck region. Once again, repeat this practice. Exhale, drop your neck, bend forward. Inhale, take your head back. Make sure you are moving only your head region, don't move the shoulders along with it. With exhale, come to the center. You can practice at your home 5 to 10 times each and every neck movement, any other movements, but here we have to focus each and every practice. So, we are doing each and every practice only 2 times. So, now next practice, neck left and right bending. Exhale, bend your neck right side. Try to touch the right ear to the right shoulder. With inhalation, come to the center. Exhale. Take your neck left side, bend left side. Very good. Inhale, come to the center. We will repeat one more time. Exhale. Drop your neck right side. Don't raise your shoulders. Feel the stretch on opposite side. Inhale, come to the center. And now, left side. Exhale. And slowly come to the center with inhalation. Third practice of neck joint, neck movement, right and left neck twisting. Exhale, twist your neck right side. Try to take your chin in the line of right shoulder. Inhale, come to the center. Exhale, take your neck left side. Feel the stretch. Twist it more. Inhale, come to the center. Then again, exhale, right side. Inhale, come to the center. Exhale, left side. Inhale, come to the center. And the last neck movement, that is neck rotation. If anyone feeling the pain of neck or feeling the problem of cervical spondylitis, so please avoid this practice. Exhale, bend, drop your neck forward. Try to touch the chin towards the chest. Now inhale, rotate your neck from the right side to the upside, and then with exhalation bring it to the downward movement. It means rotate your neck clockwise. Now reverse with inhalation, anti-clockwise direction. Very good. With open eyes, exhale, complete the round, complete the circle. This is one round. Repeat another one more round clockwise and then anti-clockwise direction. Always remember, while doing this practice, you have to open your eyes, balance on the both feet, and with slowly, don't give jerk to your neck. So with inhalation, come to the center, drop your hands and relax. Close your eyes, feel the impact of this practice on your neck joint, on your shoulder, on your breathing. Now we move to the next practice, that is shoulders movement. With inhalation, raise your arms from the sides, upstretch, above your head and palms facing outwards. Very good. Fingers together. With exhalation, bring your arms back. Again, inhale, raise your arms up. Exhale, bring your arms down. If anyone facing the problem of cervical or some spondylitis or frozen shoulder, they can modify, they can bend their elbows a little bit according to their capacity. Inhale, raise your arms up. Exhale, bring your arms down. Now we move to the next practice, shoulder rotation. Inhale, raise the arms by the side of the trunk up to the shoulder level and bend the elbows and place the fingers on your respective shoulders. Now join your elbows. Inhale, rotate your elbows in a circular manner. Inhale, raise your elbows upward and rotate it. Exhale and complete the circle. This is one round. Try to do it one more round with inhalation and exhalation. Now repeat from the other side. Always remember, while going upward you have to inhale, while going downward you have to exhale. Repeat from the other side 2 more times. When you are going upward, try to stretch your elbows upward. While going downward, try to make it closer, elbows closer to your body. Yes. Now come to the center. Spread the elbows to the sides, stretch the arms and bring your arms down. Slowly. Yes. Feel the impact of shoulder movement on your respective shoulders. So now let us move to the trunk twisting, third practice of CYP program. Keep your legs shoulder length apart, open your eyes. Inhale, raise both your arms up to the shoulder level and keeping the arms parallel, palms facing each other. This is the starting position of trunk twisting. So, now exhale, rotate your trunk towards the right side. Very good. Inhale, come to the center. Exhale, left side. Make sure your lower part is not moving too much, or you can make stable it. Inhale, come to the center. Exhale, right side. Inhale, come to the center. Exhale, left side. Inhale, come to the center. This practice increase the flexibility of your spine. Now, next practice, shoulder movement trunk twisting के बाद, after trunk twisting, we will move towards the knee movement. So, stand properly with the shoulder length apart, raise your arms upward, and with exhalation, bend your knees and come to the squatting position, half squatting position. Hands should be parallel to the shoulder level, very good. Inhale, slowly come up. Don't give pressure too much on your big toes, try to make balance. Exhale, once again bend down. Inhale, slowly come up and bring your arms down and relax. Join your legs, feel the impact of these 4 movements: neck, shoulder, trunk and knee movement. After these loosening practices, we will move towards the yogasanas. And yogasanas, we will do the standing series asana, then sitting, then prone and supine. So, for standing series asanas, we will start with the Tadasana. Stand with your feet 2 inches apart. Turn your side, please. Then we can show the proper alignment. I hope you are doing with us. So, focus how you have to stand, how you have to do it. Stand with your feet 2 inches apart. Inhale, raise your arms up to the shoulder level. Interlock your fingers. Exhale, turn your palms outward. Now, inhale, stretch your arms upward above the head. First of all, align your body. You have to relax your chest region. Surrender your thoracic region. Very good. Chest or relax करें. Yes. Stretch your back. Now focus at one point and slowly raise your heels off the floor and balance on the toes. Maintain this position with normal breathing. There is no need to hold your breath. Maintain it and observe your body from head to toe. Now slowly drop your heels, unlock your interlocked fingers, and by the sides stretch your arms and then slowly bring your arms down. Close your eyes. This asana provides balance and firmness to the body. This asana also helps the neuromuscular coordination. Now, we will move from here to the Padhastasana. Padhastasana. People having severe low back pain shall avoid this practice. We will do the Padhastasana with a modified version first. Raise your arms from the front, stretch your arms upward, properly stretch. Now bend your knees and bend forward with a straight back. Bend your knees, bend your knees, bend your knees, very good. Drop your hands, place your hand in front of your legs, drop your neck, stretch your arms a little bit more forward. Yes, relax your body. You can do Padhastasana in this position if you have a little bit back pain or you are not able to perform the final position. This is the modified version. You can bend your knees, but make sure your back is proper stretched. You can see here. Breathing should be normal. Now from here we will move towards the final position. Slowly straighten your knees, bring your palms near your feet and stretch yourself downward and inward. Never try to touch the forehead to the knees. Always stretch downward, then inward. Then you can see, if you are flexible, you can touch your forehead to the shin. So now with inhalation, slowly come back with straight back, stretch your arms upward, and slowly bring your arms from the side. Relax yourself, close your eyes, feel the impact of Padhastasana on your breathing, on your spinal region. Relax it, feel the effect. Next practice, Ardha Chakrasana. After practice of forward bending, this is compulsory doing the backward bending. This is a counter pose, we can say. So make sure you are doing it always when you are doing forward bending. Now remember this, people having giddiness, neck pain or shoulder pain, please practice with care. Now for Ardha Chakrasana, stand with the 2 inches apart. Place your hands on your waist. Very good. Elbows should be close together, parallel to each other. Feel the expansion of your thoracic region. Now with inhalation, move your head backward. With exhalation, bend more backward as much as comfortable for you. Very good. Don't bend your knees. If you are not comfortable, you can bend your knees, you can spread your legs. That is the modified version. Be there with normal breathing. Elbows close. Maintain the pressure on both feet. Slowly come back with inhalation and bring your arms down. Feel the impact. Very good. Now slowly turn. Let us move towards the Trikonasana. People having low back pain, neck pain and stiffness in the spinal region shall practice with care. Open your legs 3 to 4 feet apart. Yes. Please open it more. Yes. Now raise your arms with inhalation up to the shoulder level by the sides. Turn your palms outward. Now turn your right foot at the 90-degree angle towards the right side. With exhalation, bend towards the right side and try to place your right hand behind the right leg. First, align your body. If you are not comfortable to place the right hand behind your right leg, you can hold the shin or calf muscle. Just bend properly. Now turn your head, gaze upward at the middle finger. You can see the alignment, very beautiful. This asana strengthen the muscles of waist, thighs and shoulder. Inhale and slowly come back to the center position. Bring your right foot back to the normal position. We will do on the other side, the counter pose on the left side. Turn your left foot, exhale, bend towards the left, place the hand behind the left leg. Very good. Turn your head, adjust your body, align your body. Very good. And feel the stretch, feel the expansion of chest. Trikonasana. In every posture, you have to stable with normal breathing. In the initial stage, 3 to 5 breath, then 7 breath, then 10, and gradually you can increase the retention time, stability time. Slowly come back with inhalation. Bring your left foot back to the normal position, bring your arms back and join your legs, relax. Adjust yourself. Now, we will move towards the sitting position, that is Bhadrasana, first asana of the sitting position. So, first you sit in Vajrasana. Yes. From here, just come to the Dandasana. Dandasana, it's seem to be similar, very easy posture, but it's not to be easy. You have to join your legs properly. You have to place your palms firmly on the ground. beside the hips. Stretch your back. Your body should be aligned. Observe your breathing. Close your eyes. Dandasana. It helps to balance on the left and right alignment also. So, from here we will move towards the Bhadrasana. Now bend your knees with exhalation. Put the soles of your feet together and hold your toes. Very good. Now pull your heels towards the body as much as comfortable to yourself. Now push your knees downward. Stretch your back. Yes. Maintain this posture with normal breathing. Close your eyes or gaze at one point. This asana keeps the abdominal muscles healthy, or we can say Bhadrasana is a boon for ladies. Slowly come back to the Dandasana. Now we move towards the Ushtrasana. For Ushtrasana, slowly come in Vajrasana. Bend your one leg and place it under the hip region, then other leg. Similarly, place your hands on your knees, big toes touching each other. You are sitting between your hips. This is the posture. This is called Vajrasana. Now from here, stand on your knees, come to the kneeling position. Now spread your knees little bit, few inches apart, same, few inches apart your feet. For Ushtrasana, you have to make sure your back is flexible. If you are not comfortable for doing the Ushtrasana, you can perform the Ardha Ushtrasana. But we are going to show you or do the practice of Ushtrasana. With inhalation, bend your neck backward. Very good. And now take your hands, place them on the respective heels. Exhale, bend more. Very good. Hold your heels. Very good. Push your hip forward, push your lower back forward. Very good. Maintain the final position with normal breathing. Don't hold your breath. Expansion of the chest, you can feel it. This asana also helps the spine and back muscles and improves the eyesight. Slowly come back with inhalation. Don't come with a jerk. Usually people do this mistake. Slowly come back to the Vajrasana. I was talking about don't come with a jerk. You have to come with inhalation and slowly. Now, after Ushtrasana, we will move towards the Shashank Asana, or usually people say Shashank Asana. Inhale, spread both the knees comfortably apart. Very good. Place your hand between your knees. Remember it, you are not going to raise the hip region. With exhalation, bend forward, stretch the arms to the front and place the arms, chin and chest on the ground. Very good. Stretch your back. Relax here. Relax each and every body part. There is no tightness in any joint, any body part. Relax each and every body part from head to toe. This asana helps to reduce stress and anxiety. Observe your breathing, how you are inhaling and exhaling. With breathing, relax yourself, maintain the position. Now slowly come back to the starting position in Vajrasana. With the help of hands, join your legs and relax in Vajrasana. Feel the impact of Shashankasana. Now we move towards the Uttan Mandukasana. Slowly turn this side. People with severe low back pain, knee pain, stiffness of the knees, back shall practice with care. If the person having the osteoarthritis knee, so don't sit in Vajrasana, they can do this practice without sitting in the Vajrasana, they can do with their arms and opposite shoulders, they can touch it. Now for Uttan Mandukasana, spread your legs, spread your knees, very good, big toes touching each other. Now inhale, raise your arms from the front, properly stretch. Now exhale, fold your right arm and place the palm on the left shoulder blade. Similarly, fold your left arm and place the palm on the right shoulder blade. Relax your chest region, relax your chest, very good. Neck should be center. Keep the back and neck straight. Maintain the final position with normal breathing. You can gaze at one point or you can close the eyes and maintain it. This asana is helpful in backache and cervical spondylosis. Be there and feel it. When you are stable in the posture, you have to observe the sharira, shwasa, samvedana, means the body, breath and the sensation of the body. Inhale, raise the arms up. Exhale, bring your arms down and the knees close to each other. Now slowly bend little towards the left side, take your legs out and come to the Dandasana, to that side. Yes. And now relax in Vishramasana, feel the impact. Very good. Now we move to the last sitting posture of CYP program, that Vakrasana. Hope you are doing with us. Vakrasana. First of all, we will show the modified version. Usually people just trying to touch the final position and they are not aware their shoulder is getting closer and their chest is not expanding properly, they are getting compressed. This is not we require in the Vakrasana. We have to stretch the back, expand the shoulders and expand the chest, then we have to twist it. So you can do the modified version if you are not able to perform the final position. So come to the Dandasana. Yes. Bend your right leg with inhalation. Just hold knee from the top, not too much, yes. Place your right hand behind your hips. You can see how he is doing. Stretch your back. With exhalation, twist your back, twist your neck as much as possible. You can see the alignment. Relax the other leg. Very good. Twist it more, very good. You can take support of the right hand, but don't give too much pressure. Don't leaning towards the hand. Just align it. Maintain the position with breathing. Come back slowly. Very good. Repeat this practice on the other side. Show the modified version. Very good. You can see. Hold the knee, twist it, twist it, twist it. Very good. Now from here we can move towards the final position. Take your hand and hold the arch of the feet. Very good. Stretch your back. You can see how beautifully he is doing it. You can see the alignment. Alignment matters a lot in the yoga asanas. Observe the breathing, observe the body and slowly come back to the starting position and relax in Vishramasana. Now let us move on to the prone postures. We have finished the Sukshma Kriyas, the loosening practices, then standing series asanas, sitting series asanas. Now time to do the practice of prone postures. Lie down slowly on your abdomen region with the feet comfortably apart. First of all, we will do the Makarasana. Feet comfortably apart, toes pointing outward. Bend both arms, place your head Twist your neck. Yes. Keep your eyes closed and relax your body. This is the Makarasana. So, Makarasana helps to relax body and mind, and this is the relaxation pose of prone series posture. From here we will move towards the Bhujangasana. Join your legs, stretch your arms forward and chin rest on the ground. Now with inhalation, place your hand near your chest region, beneath the shoulder. Yes. Elbows close to the body. This is the position, starting position of Bhujangasana. With inhalation, slowly lift up the upper body up to the navel region without exerting pressure on the arms. Usually people wide their elbows and try to lift it, and they feel the pressure on the tricep muscles. Here we are closing the elbows, stretching the upper body, just lift it more up, you can see. Now focus on the breathing, maintain the position. This asana reduces extra fat of the abdominal region and relieves from constipation. With exhalation, slowly come back to the normal position and relax in Makarasana. Now we will do Shalabhasana, but if you are not comfortable, do the Shalabhasana. You can do the simplified version, or we can say the Ardha Shalabhasana, Ek Pad Shalabhasana. Join your legs, place your palms beside your thighs, palms facing downward or upward. Now slowly raise your right leg without bending the knee. With inhalation as much as possible. This is Ardha Shalabhasana. It's very good for sciatica pain and for back pain patients. Slowly bring your right leg. Repeat with other leg. Inhale, lift your left leg. Chin rest on the floor. Breathing should be normal. Slowly come back. Now we will do the final position. Turn your palms downward. With pressure of the palms, it helps to lift the both legs. With inhalation, raise the legs off the floor as much as you can and keep the legs straight. You are not going to raise the chin. Maintain the final position with normal breathing. Slowly bring the legs down and relax. Come to the Makarasana. Bring the arms back to the initial position, feet widely apart, toes pointing outwards. Shalabhasana helps in sciatica and backache. If you are not comfortable to do with both legs, you can perform with one leg. We have taught it. Now we move to the spine postures. Turn your body and lie down on your back. According to CYP program, the first posture of the supine, that is Setu Bandhasana. Now we are going to start. First of all, stretch your arms backward above your head. Stretch your whole body, join your legs. Drop your back downward, push your back downward, stretch, and slowly come back. Very good. Now bend your knees. Adjust your body and clothes. Yes. Bring your heels towards the buttocks. Place your hands properly beside your hips, or if you are able to hold your ankles, then you can hold. Now get ready to lift up your hips and lower back with inhalation. Inhale, raise your buttocks and trunk to form a bridge, a Setu. That is Setu Bandhasana. You can see the final position. In the final position, keep the shoulders and the head in contact with the floor. Don't lift it. Maintain the final position with normal breathing. If it is possible, with few breathing and try to push more up, then maintain. When you feel comfortable, then lift it more up. Yes. This asana is found beneficial in depression, strengthen lower back muscles, stretch abdominal organs and improves digestion. Slowly with exhalation come back, straighten your legs and relax in Shavasana. This asana also helps to relieve constipation. Feel the impact of this practice. Now we are going to do another posture that is not a part of CYP, but we will do Saral Matsyasana. We have introduced 2 or 3 days earlier. Saral Matsyasana, avoid in case of severe back pain, severe neck pain. Now bring the legs together and place the hands beside the body. Now raise both the arms above the head and place the palm beside the head. Keep the elbows parallel to each other. Inhale with support of the palms, lift your chest and try to place the crown of the head on the ground without neck strain. And place your hands beside your thighs or on your thighs. You can see how beautifully he has done it, the arch. Make sure you are not straining your neck region. Maintain the position with normal breathing. It opens up the chest and improves the lungs capacity. This asana helps it. It's very good for respiratory problems. Now slowly come back with the support of hands with inhalation and relax in Shavasana. Now we move towards the next posture, that is Uttana Padasana, but usually people are not able to stable in this posture prolonged period. They can stable around 5 seconds or 10 seconds, but if you are not comfortable, if you have too much back pain, you can do Ek Pad Uttana Padasana. We will show you the simplified version. Join your legs, place your palms beside the thighs, just raise your right leg at the 30-degree angle. Maintain the position with normal breathing. Slowly come back. Don't hold the breath while doing the simplified version or final position. Inhale, lift up the left leg, toes pointing forward, but don't tighten it, relax it. Slowly come back. This was the simplified version or modified version of the Uttana Padasana. Now ready for the final position. Join your legs. Avoid the practice in case of low back pain or abdominal hernia. If you have a low back pain, you can do it with one leg. Now bring the legs together. Inhale. Slowly raise both the legs without bending the knees until to see your knees, to see your toes. Maintain the position. This asana strengthens the navel center and helps to improve breathing capacity. You can see, you can feel the vibration of your abdominal region if you are doing along with us. Slowly come back and relax in Shavasana. After the Uttana Padasana, feel the impact, how your breathing has become longer and deeper. Now, next practice is Ardha Halasana, the half plow posture. Avoid this practice in case of low back pain or abdominal hernia, but we can do the modified version also in this for low back pain patients. Join your legs, place your hands beside the thighs, raise your right leg up, very good, at the 90-degree angle, yes. From the heel to hip is straightened, very good. Slowly exhale, bring the right leg back, and now similarly repeat the practice with the left leg. Very good. Don't tighten the shoulders, don't tighten the neck region. Slowly come back. If you are not able to perform the Ardha Halasana with both legs, you can do it in the initial stage with one leg, and then later on you can do it with both legs, how it seems. Look at this. With inhalation, raise both the legs without bending the knees at 90-degree angle. Yes. If you are not comfortable, you can bend your knees little bit, it's okay. Or if you are able to perform, make your legs straighten. Yes. Close your eyes. Feel the inhalation and exhalation and be there, maintain the position. This asana found beneficial in the management of hypertension, but don't hold your breath, don't tighten your body, comfortable, stable. Sthira Sukhamasana. Slowly come back with exhalation, bring your legs down without raising your neck and relax in Shavasana. Now we move towards the Pavan Muktasana. Avoid this practice in case of abdominal injuries, abdominal hernia or severe neck pain. Now join your legs, bring your legs together, place your palms beside the thighs, palms facing downward. Exhale, bend both the knees and bring them towards the chest region. Very good. Inhale, interlock your fingers and clasp the legs together just below the knees or near the shin region, toes pointing outward. If anyone having the severe neck pain, cervical spondylitis, don't raise the neck and maintain the position like this in the final position. But if you don't have a neck pain, shoulder pain, with exhalation, lift your neck up, try to touch the chin or nose, whichever is comfortable, not forcefully, comfortably. Don't tighten the shoulder, maintain the position, and you should not hold your breath. Very good. Pavan Muktasana, it's very good for digestion, improves metabolism. Slowly with inhalation, bring your neck down, unlock your fingers. With exhalation, straighten your legs and relax in Shavasana. Now, time for relaxation, time for practice that posture which is waiting from the first posture, that is Shavasana. I usually say Vishwapriyasana, Shavasana. So, for Shavasana, spread the legs sideways, hands by the side of the body and palms facing outward, upward, with arms and legs comfortably apart. Feel the contact of the body with the ground. Just open your right leg more and relax yourself. Check your neck region, is it in center or not? Check your shoulders region, is it relaxed or tighten it? Check your palms or fingers, is it relaxed or tighten it? If it's tightened, make it relax. Toes, legs should be loose and relaxed. From head to toe and toe to head, watch each and every body part. Yes. In Shavasana, we are going to feel and relax, first of all, those body parts which are touching the ground. So, bring your awareness, first of all, on your heels. With closed eyes, observe your heels and surrender your body weight of the heels on the ground. Feel the touch. Then slowly bring your awareness on your calf muscles. Feel the touch of your calves with the ground. Relax it. Then focus on your knees, back of the knee region. Then thighs. Thighs should be loose and relaxed. Feel the touch of your thighs with the ground. Lower back, upper back, then shoulder region, both the arms, back of the palm region. Each and every part should be loose, which is touching the ground. Now focus on your head region. Feel the touch of your head with the ground and relax it. Now bring your awareness on the center of your body, that become aware, the navel center. Feel the inhalation and exhalation. Become aware of the natural flow of breath and movement of the navel region. Relax, relax. Now, slowly become aware of your breathing. Take a deep, long inhale and exhale. Move your toes and fingers. Join your legs. Stretch your arms slowly by the sides. Open your arms. Yes, stretch it. And now turn right side or left side. With support of other hand, sit at your place. Very good. If you have done the proper loosening practices, proper asanas and proper relaxation, you can see the impact. Now, after the yoga asanas, we will move the first cleansing practice, that Kapalabhati Kriya, that helps to clean the nasal passage. We have introduced in the last session. So, adopt Jnana Mudra of both hands. Sit in any comfortable posture. Stretch your back and close your eyes. In Kapalabhati Kriya, inhale deeply and expel the breath with forceful contraction of the abdominal muscles. In this process, active exhalation and passive inhalation. Now, start the first round. Let us begin. Of 30 strokes. Exhale slowly, completely, and feel the impact. While doing Kapalabhati, don't let your mind to roam here and there. Focus on the sound of exhalation and make it rhythmic, 1 second, 1 stroke, or gradually you can increase the speed. Focus on the body. You are not going to tighten your facial muscles. Don't lift the shoulders. Don't drop the back. So much things to be focused while doing the Kapalabhati, body, breath. But People usually do the Kapalabhati and moving the mind, and they just practice involuntary. They have started this practice. No, it's not good. Now, we will do the other round, back straight. With awareness, start the second round and the last round of Kapalabhati. Exhale completely. Feel the impact of Kapalabhati in your head region, in your breathing pattern. Be there and observe the changes. Go with the flow. And now, we will do the Anulom Vilom Pranayam. We are doing it continuously from the first session, but today we will introduce it small basics and small more things which you have to remember while doing the Anulom Vilom Pranayam. So, for Anulom Vilom Pranayam, you have to adopt any meditative posture. You can sit in Sukhasana, Ardha Padmasana, Vajrasana or Padmasana. Left hand should be in Gyan Mudra, the tip of the thumb and index finger, and remaining 3 fingers should be loose and together. Adopt Pranayam Mudra of the right hand. Just show the how we have to make the Pranayam Mudra. Make fist properly, make fist and open the last 2 fingers like this. You can see the Pranayam Mudra. And now, bring this mudra close to your chin, close to your nose. This is the position you have before starting the Anulom Vilom Pranayam. Don't raise your elbows, don't tighten your shoulders. Check your back, check your neck. Now, exhale completely from both nostrils. Very good. Gradually close the right nostril on this part of the nose. Now, inhale slowly from bottom to top. 1, 2, 3, 4, 5, 6. Close both nostrils. Exhale from right. 1, 2, 3, 4, 5, 6. Now, inhale from right. 1, 2, 3, 4, 5, 6. Close both nostrils. Exhale from left. 1, 2, 3, 4, 5, 6. This is one round of ratio 1:1. Repeat 2 more rounds. Make sure your back is straight, elbow is closed. You are not giving too much force on the nose by the fingers. We have done the round first with 6 inhalation, 6 counting of inhalation, 6 counting of exhalation. If you are not comfortable to do the practice at the 6 or 6, you can do it 4 inhalation, 4 exhalation, but make sure your exhalation is not less than the inhalation. You have to slowly, gradually increase the speed, increase the exhalation time, but it should be with flow, not jerk. Initially you can do 1:1 and later on you can do 1:2. It means if you are doing the inhalation 6 counting, you have to later on the good practitioner can do exhale at the 12 seconds. There is no need to hold your breath in the initial stage. For CYP program, it's a 1:1. inhale and exhale. Flow of breath. Anulom Vilom pranayams helps to improve concentration and calms down the mind. Now exhale from left and bring your right hand back to the Jnana Mudra. Now we will introduce the Shitali Pranayam. Shitali Pranayam, it's a cooling pranayam, usually people say, but here it also helps to for beneficial for high blood pressure and improves concentration. So how you have to do the Shitali Pranayam? Adopt Jnana Mudra of both hands, be in the meditative posture, keep your eyes closed, back straight, roll the tongue out from the sides, roll the tongue out properly. You can see you have to push your tongue out and now roll the tongue from the sides to the shape as a tubular form. Take your tongue out, roll it, form it the shape of tubular form and inhale deeply through this tubular shaped tongue, and after complete inhalation take your tongue inside, slowly exhale from both nostrils. This is the one round of Shitali Pranayam. We will do 2 more rounds. Take your tongue out, roll it from the sides, inhale deeply, do not give the jerks for inhalation. After complete inhalation, take your tongue inside and exhale from both nostrils. Repeat 1 more round. Yes. Push it more out. Yes. And slowly exhale. Feel the impact of Shitali Pranayam on your thoracic region, on your throat region. Yes. And now we move towards the dhyana. Dhyan. It's a great tranquilizer. No one can teach the dhyan. You have to do the practice at your own, but you have to learn how we have to do the dhyan, what the steps to do the dhyan. We will discuss today in the lecture session. First of all, back straight. Adopt any meditative posture. Close your eyes. Observe the body. After observing the body, observe your breathing, how you are inhaling and exhaling. And now, watch your thoughts and emotions. Let it go, your thoughts. Don't stuck at it. Just be there, observe it, and go with the flow. Meditate. Meditation is the most important component of yoga practice. It keeps the mind calm and quiet. Meditation brings clarity in thoughts. Now, move your awareness once again on your breathing. Slowly inhale deeply and exhale completely. Come back to the outer world. Now join your palms for Shanti part. Inhale deeply. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschit dukh bhag bhave, ma kaschit dukh bhag bhave. Om Shanti Shanti Shanti. Gently place your palms on your eyes and open your eyes there. Bring your arms back. Thank you. Stay happy and stay healthy. Jai Hind, Jai Bharat. We have finished the practical session. Be there along with us. We will do the lecture session just after 1 or 2 minutes. We will start the lecture session, and today's topic is very beautiful topic, that is dhyana. So be there. After 1 minute we will be right back. Thank you. Start karo. Namaskar. Once again, welcome to all. In the lecture session, we have done the practical session, and in the practical session, before start the lecture session, you have seen it. We have done in the practical session the kriyas, the loosening practices, the asana and pranayam practice. Then we move towards the dhyana. So today topic of lecture, that is, you can see here, Dhyan, a great tranquilizer. Usually, that word, when you heard dhyan or meditation, people thinks it not happen with us, it's not for us. Maybe the old age people can do the meditation, a good meditation, but young age generation at my age, usually people thinks dhyan is not for them. This is the misconception. Dhyan is not for any specific age group, it's not for any religion, it's not for any caste or creed. Dhyan is for everyone, meditation for everyone. But you have to learn how to go in the meditation stage by steps. People usually sit with closed eyes and start watching the thoughts. They think they are doing meditation. People usually sit in the posture, they learn by the videos, and then they start closing their eyes. After few minutes, they feel dizziness or sleepy, and they think they are doing meditation. Sleeping in sitting position is not meditation. Watching thoughts is not the way of meditation. What is dhyan actually? What is dhyan? What are the types of dhyan? We will discuss today here. So let's begin in the world of dhyana. If we talk about the dhyana, we have to learn Ashtanga Yoga. We have to remember the Ashtanga Yoga. We have discussed earlier in our previous lectures Ashtanga Yoga by the Maharishi Patanjali. He has given this Ashtanga Yoga in the Patanjali Yoga Sutra. Yama, Niyama, Pranayam, Yama, Niyam, Asana, Pranayam, Pratyahar, Dharana, Dhyana, Samadhi. The first five, that Yam, Niyam, Asana, Pranayam, Pratyahar, this is called Bhirang Yoga. And Dharana, Dhyana, Samadhi, that is Antarang Yoga. So you can understand this terminology, Bhirang Yoga or Antarang Yoga. But you have to reach the dhyana. When you want to do the dhyana, before dhyana, you have to do the dharana. What is dharana? So let's discuss here. Dharana means concentration or introspective focus and one-pointedness of mind. The word comes dharana from the root, that is dhri, means to hold, to maintain or to keep. Dharana in Ashtanga Yoga, Maharishi Patanjali told us, Desh Bande Chitta Se Dharana. It means Chit, which is usually people say the mind, but it's different thing, is extremely wavering. It's always like the waves. To engage it in particular one point, one area, that is called dharana. Or if I say to dharana, select one object. Now you have to continuously be that object. With that object, no other thoughts will disturb you, and you are comfortable with that object. You feel oneness with that object. That is dharana. And before dharana or dhyan, we have to understand few more things. Let's start. Usually people start learning dhyana, but before understand dharana and dhyan, we have to learn or remember few other things. If I talking about dhyan, so we have to maintain the body. We have to prepare our body for dhyan. How we can do it? We have to remember the prerequisite, that is 2 or 3 prerequisite. We have to remember it and we have to work on it for good practitioner who is want to be dhyan, who want to be state of dhyan, meditation. So what is the prerequisite? First prerequisite is shaucha, that is purification, that shat karma, you can say dhoti, basti, neti, noli, trataka, kapala bhati, that cleans your, detoxify your body, that cleans your body and mind. And then we have to focus on the ahara. If you are following the proper diet, we will discuss the proper lecture of the diet later on, but if you are following the proper diet according to the Shastra, light food, sattvic food, light diet, then you are comfortable then you will be able to do the meditation. People usually eat too much and then they think they can sit and meditate. Sorry, but you will feel sleepiness, not meditation stage. So now you have to focus, you have to remember ahar is also one precaution. And the third, the yama niyama, you have to remember that Ashtanga Yoga, yama, ahimsa, satya, aste, brahmacharya, aparigraha, niyama, shaucha, santosha, tapa, swadhyaya, ishwar pranidhan. If you work on it also, that you are easy to connect with yourself, to concentrate more in dhyana stage. These were the prerequisite, and now if we talk about abhyasa, what we have to do before the dhyana, that is first we have to stable the body. How it happens? How we can stable the body? If you are not the practitioner of yoga and we sit, if you are not practitioner of body, if you are not comfortable with body, we sit and later on we may feel the pain in our legs, we may feel the pain in our back. So how we can connect with ourselves? How can we go in the deeper state of meditation? So for that, body will not be the hurdle. How we have to manage? We have to focus, we have to stable the body with the help of asanas. You have to learn properly yogasanas, or you can do the postures according to your body capacity, standing, sitting, supine and prone. You have to stable your body. Maharishi Patanjali said, Sthir Sukham asana. After the asanas, the tato dvandva anibhigat, that your duality will be finished. Then you are ready for the pranayama, to clean the energy channels, that you clean the nadis, 72,000 nadis around it. You have to clean the nadis, and after cleaning the nadis, you have to focus. But before pranayama, you have to start with a breathing practice. It enhances the lungs capacity. Gradually you move towards the pranayama stage. There are different types of pranayama according to the personality, according to the doshas, vata, pitta, kapha. People do that pranayama, and then you are ready for the pratyahara. What is pratyahara? Withdrawal of senses. If you are taking proper diet, proper body posture, your breathing is proper, but if you are not sleeping too much, or if you are not taking the sleep properly, you will feel sleepiness in the dhyana stage. So you have to relax yourself, and it helps in the practice of pratyahara, or we can say yoga nidra. So do this abhyasa before going the stage of antaranga yoga dharana. So we have to focus prerequisite, that is shaucha, purification. That second one is ahar, sattvic ahar, mita ahar or yukta ahar, and the third one is yama, niyama. And the abhyas, if we talk about what we have to remember before dhyana, then asanas, yogasana, or then pranayama, pratyahara, yoga nidra, or then we move towards the dharana and dhyana. What is dhyana? Dhyana is the Sanskrit word that is meaning meditation. Usually people say we are doing yoga and meditation. Most of the people always say you are doing yoga and meditation. How can you separate it? Meditation is the final stage of yoga, higher state of yoga, and before meditation you have to follow the process which I have told you, and that is also yoga. So it is derived the root word dhi, and that means to contemplate, you have to focus it. So dhyana, you have to remember from where the word dhyana comes, that the root word is dhri, and meaning of this is to contemplate. Dhyana in Ashtanga Yoga, Maharishi Patanjali said, Tatra ekatanta dhyana. It means the flow, once even smooth flow, continuously flow, that full concentration of the mind, focus on one of these experiences. Tat pratyek tanta dhyanam. If you are pouring the oil, you can see the rhythm, you can see the flow, even flow. That is the state of dhyana. But before a dhyana, we say what we have to do, we have to remember, we have told you earlier. And after the dhyana, what you will get, that is samadhi state. What is samadhi? Only the objects appearing with the consciousness of one own self. It means in dhyana there is a thing, the person and that object, and then samadhi only the process, not other things. We can say for dhyana, dhyata, dhyaya or dhyan. Dhyata, dhyaya or dhyan. Dhyata is the person who is trying to connect with their self meditation. Dhyaya is the object which taking in the dharana, and then dhyana is the process. So when you doing the dhyana, then later on it becomes samadhi, then only the process will remember. Dhyata and they will be the merge. So here I am trying to tell you what is dharana, difference between dhyana and samadhi. You can see the small lines. You are focusing on one object. That object may be the goddess picture, god and goddess picture, one beautiful flower, one symbol with closed eyes, or you can focus it and your concentration will move here and there, then again you are concentrating it. That is dharana. But if you are doing it for prolonged period, that is dhyana. And later on, I told you earlier, when the object and the person, the subject has merged and only the process remember, that remain, that is samadhi. You can see dharana, dhyana and samadhi. So before this you have to focus, we have to remember all those practices which I have told you earlier. So now later on, according to Shastra, according to text, Hatha Yogic text, there are different Hatha Yogic texts, Hat Pratipika, Ghiran Sahita, Hat Ratnavali, Shiv Sahita. But according to Ghiran Sahita by Ghiran Rishi, he taught us there are three types of dhyana: Sthul dhyana, Sukshma dhyana, Jyoti dhyana. Sthula dhyana, that is gross body. You have to focus on one image. With closed eyes, you have to stable on the one posture and focus at one image. And then it's Jyotir dhyana. If you're talking about the Jyotir dhyana, Tejomaya, that the Bhrumadhya, you have to focus on one light and continuously go with that light. And if you're talking about the Sukshma dhyana, it's the higher stage, that you have to focus on the consciousness. That is a subtler practice. But we have to practice, the new practitioner have to practice the Sthula dhyana, or we can say dharana, then it becomes the dhyana. In Shastras also there is a two types of differentiate, that Saguna or Nirguna. That Sthul or Jyotir is a Sagun dhyana, where the gunas are available, and Sukshma dhyana there is a gun is not required. So this is the three types of dhyana in the text. In Bhagavad Gita, Lord Krishna also taught us in the 6th chapter about the dhyana yoga. It's properly on dhyana yoga. You can read it, you can understand it, what he want to say. In this chapter, Krishna reveals the meditation, how to practice this dhyana yoga. So it's not only from nowadays, dhyana is very popular. People think we have to do the dhyana, we have to do the meditation to relax the body and mind. But dhyana is not from now, it's prolonged period from the time of when the yoga has begun. In Bhagavad Gita there is also one properly, Krishna is talking about the dhyana. So now types of meditation. What is meditation we have discussed? Tatra pratyek tanta dhyana. What is dharana we have discussed? Deshbande chittasya dharana. Focus at one point continuously. and later on it becomes dhyana. Now, what is the types of meditation? We have learned the 3 types of the meditation: sthul, sukshma, jyotir dhyana. According to the Shastra, Ghiran Rishi told us in the Ghiran Sahita, but nowadays Vipassana dhyana, Preksha dhyana, transcendental meditation or any other, many more are very popular. What is Vipassana dhyana? We have to concise our lecture in few words if we are talking about the Vipassana. Vipassana means to see, to observe, to see. And here we have to learn how to continuously see the anapan, to inhalation and exhalation with mon. You have to not speak a single word and connect with yourself. Always sit and observe your breathing. And there is some other steps also to go inside in the Vipassana process. So, Vipassana Dhyan to see, and nowadays very popular, it comes from the Buddhism. Now, if we are talking about the Jainism Dhyan Paddhati, that is Preksha Dhyan. Preksha Dhyan is also similar to the to see, but in there are some steps are there. Kayotsarga, observing the each and every body part, Anupreksha, Antaryatra or Leksha Dhyan. So, these are the steps in the Preksha Dhyan. It comes from the Jainism Paddhati, and Vipassana Dhyan comes from the Buddhism Paddhati. So, these are very popular nowadays, and transcendental meditation that Maharishi Mahesh Yogi has given, started the transcendental meditation. In this, there are some steps, the Guru given the one mantra, and continuously you have to ajap with the inhalation and exhalation flow, and some more other things are, some other process are there. But if you are going, if you are learning one practice, how you have to do the dhyana, so you have to follow each and every step of that practice, that way. Remember, like if I want to go somewhere, so I have to follow the properly path. Mid of the path, I change my mind, now I will go with from the other path, and from other path I will change my other mind. So, that I will never reach at my destiny. We have to believe, we have to follow the procedure, and then we have to surrender it, then we can feel the stage of dhyana. So, we can do the sthula, sukshma, jyoti dhyana, you can learn it, Vipassana, Preksha, transcendental and many more, Om meditation also available there. Result of dhyana, we say aim of practice dhyana is become free from the samskara. We have to learn dhyana for what? That when we are doing dhyana, when we are at the final stage, what will happen? That aim of practice dhyana is become free from samskara, that those things which we are always collecting and storing inside, we have to free from it, then we can connect ourselves. Benefit of meditation, if we are talking about the benefit of meditation, that physiological, psychological benefits, there are lots and lots of benefit. But if you are doing the dhyana only for one purpose, that is only the destination you will reach. Because if I want to reach 2 kilometers, then I can reach. But if my destination is, I have targeted longer, then I can go longer. So, never stick with only one benefit. I have to do the meditation for relaxation the mind. This is the byproduct you will get. You have to learn it, you have to connect with it, you have to purify yourself, you have to balance your diet, you have to balance your sleep, you have to stable your body with asanas, pranayama on the regular basis. Then you will sit for meditation. Then later on regular basis you will connect with yourself. The benefit of relaxation of mind is not matters, that you will get it byproductly. If you start focusing, if you are doing the dhyana and then later on dhyana happens, you can see the benefits. I have mentioned some benefits here. Enhance immune system function, stimulate the pituitary gland and hypothalamus, thus releasing endorphins hormone, internal painkiller we say. Long term meditation associated with the increased gray matter changes in amygdala, cerebral blood flow in the brain, which is associated with learning, increasing the learning power, memory, emotional regulation. emotional disbalance, we will resolve it by the dhyana, response control. And later on, you can see the other benefit. The regular practice of dhyana helps control many problems. Negative emotions like anger, fear, depression, stress, tension, anxiety, no one is escaped. Nowadays, life is too much tense. In 24 hours, we are living like the 48 hours. But if we are doing meditation, we can resolve this problem, we can reduce this and get the calm state of the mind. Dhyan also increases the concentration, memory, confidence, clarity of thoughts and willpower. That is much more important thing. Dhyan rejuvenates us completely to cope up with the stressful situation facing day-to-day life. It makes person positive and energetic. That clear the aura, the person will calm and relax, sparking. You can see the evidence-based research shows that the practice of meditation and yoga nidra heighten the theta and alpha waves. There is a waves in the brain, alpha, beta, theta, gamma. You can see the impact of this. A normal person, I show you by the cursor, you can see normal person doing the brain waves, and after the 15-minute of dhyana and after the 25-minute wave. So, it impacts on the alpha and theta waves. Beta waves, awake and active, always we are in the active state. Alpha wave, relax and light meditation, and theta waves, meditation and deep relaxation. And when we are in the meditation stage, our breathing is less low. That chale vate chalam chittam. Our breathing is going deeper, we are going in the deeper state. These were the slides we have discussed about the dhyana, but remember that I always say nobody can teach you dhyana how to go in the final stage, but everybody can teach you the steps. But at the final stage, you have to connect with yourself. You have to surrender with yourself. You have to follow the procedure how to go in the deeper stage of dhyana. Dhyan never happens by the anyone. Nowadays, we don't have those teachers that they touch and you will get like alignment, like the Swami Vivekananda and all. So, you have to focus, you have to follow the procedure. If you want to learn these steps, you can have to learn the prerequisite and you have to learn abhyasa, you have to practice it, then sit, observe the body. First of all, I will tell you the simple steps what I follow. Body, first of all observe the body, then breath, and then sensation of the body. Then later on I start connecting with myself as much as I have done it. So, do meditate regularly and do those practices I have told you earlier. Remember those practices. Dhyana start becomes the dhyana, then later on you will reach the higher state. So, this was the lecture about dhyana. Thank you. Dhanyavad. Om Shanti Shanti Shanti. Thank you. Jai Hind, Jai Bharat.